We have Director Cartmel online. We'll start with introductions. I am the Director of Rural Health at SWOSU in Weatherford, but I represent this board as a PARB member, as a former foster and adoptive parent.
I am Shell Millington or Sharon. I'll respond to either. I am interim executive director of the Office of
Timothy Michaels Johnson. I am a managing attorney with the Oklahoma Office of Family Representation, and I represent the Oklahoma Bar Association.
Clay Bullard, the director of the Oklahoma Healthcare Authority.
I'm Hannah Whip. I'm the director for the Oklahoma County Juvenile Bureau, so I serve in the director for the Juvenile Bureau seat.
P3, Commissioner of Health, Oklahoma State Department of Health.
I'm Brian Larison. I'm the CEO of Lions Meadows of Hope, a foster care agency, and I represent Oklahoma Children's Agencies and Residential Enterprises.
Dr. Lynn Aaron, I represent CASA.
I'm Jason Hicks, the district attorney for the 6th district, which is Caddo, Grady, Stevens, Jefferson County. I'm a representative from the District Attorney's Council.
Melinda Front, Executive Director of the Oklahoma Rehabilitation Services.
Ty Mowdy with the Oklahoma Attorney General's Office.
I think I have quorum.
Yes.
Director Cartmel.
Jeffrey Cartmel, Director of Oklahoma Human Services.
We don't have anyone for public comment.
Nope.
Okay. And then any discussion regarding the minutes for the last meeting? Or this? If not, we can take a vote to approve. If I have a motion.
Move to approve the minutes.
Yeah. And then we can vote.
Commissioner Aaron,
Yes.
CEO Builder,
Yes.
Director Cartmel,
Yes.
Director Front,
Yes.
District Attorney Hicks.
Yes.
Commissioner Hurd,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Abstained.
Commissioner Reed,
Same.
Yes. Okay, motion passes. Next, this is one of my favorite parts of our meeting is we're going to have a presentation from the Parent Partnership Board. We have Dina here. No, welcome.
Would you like for me to stand at the podium?
Yes.
Yeah. Okay. Good morning, and thank you for allowing me to speak with you guys today. My name is Dina Drabeck, and I am a single working mom of 2 adopted children from Oklahoma's foster care system. I'm also a member of the Parent Partnership Board, but today I'm coming to you as a caregiver because November is Family Caregiver Month. And if you don't already know it, there is a caregiver crisis happening across our nation and right here in our state. People often assume that insurance companies and government programs, schools and nonprofits are adequately serving caregiving families, but research tells us otherwise, that caregivers are at risk. Caregivers experience higher levels of stress and depression, burnout. Families often run into underfunded or non-existent services and long wait lists and constant battles just to access the supports that they're already legally entitled to. They're more likely to become seriously ill, lose their jobs, or lose their health coverage. Caregivers across our state are literally hanging on by a thread, and I'm living proof. So let me tell you why. My son is medically complex. He was born with a congenital heart defect and needed 3 open heart surgeries before he entered kindergarten. And just months after his private duty nursing services were completely cut, he suffered life-threatening complications and spent a month in the ICU on ECMO life support, which is what kept him alive when his body could not. I'm grateful every single day that he survived. But that does not take away from everything that I had to battle with insurance and denials, the endless maze of paperwork. It's all required just to keep him healthy. And that alone would have been enough to overwhelm most families. But when my son was just 3 years old, I took foster placement of a baby girl who was born with drugs in her system. And while she didn't have the same medical complexities that my son does, her behavioral health needs have come to be just as serious. I was her only foster placement from the moment that she left the hospital. But that didn't prevent the trauma that comes with spending 2 years in the child welfare system. I was eventually asked to adopt her, but not before I suffered a mini stroke in my early 40s. And I'm grateful to be alive. But I also know why this happened. This is what caregiver burnout looks like when systems fail to support family caregivers who are already stretched to their breaking point. Now, I've been lucky to have my mom who's helped me as my backup caregiver. She actually moved in with us during COVID. And she's been my relief when I've had none, until a year ago when she had a brain abscess, and that left her unable to walk. So she's now in a nursing home. And I'm her power of attorney. And of course, I'm grateful that I've still got her, but now I'm navigating the long-term care system, which puts enormous emotional and financial strain on families, especially those like mine in the sandwich generation. So I've got young kids at home and also taking care of an aging parent. And still trying to, hold down the full-time job and contribute to my community. And I share all of this not because my story is unique, but the outcomes are. The reality is what happened to my family is what happens to other families in Oklahoma too. But if it were any other family's story, they may not have fared as well. The difference is I have advantages many Oklahoma caregivers do not. I have a master's degree, stable income, a professional network, and experience navigating complex systems. But even with all of that, I was barely hanging on. And even then, it was my own choice to enter the system by way of adoption. So if I hadn't worked for a boss with her own experience raising a child with special needs, I might not have had a job when my son spent a month in the hospital fighting for his life. If I lost my own health insurance, I might not have gone to the doctor to see about my vision issues, which turns out was tied to the stroke I didn't know I had. And if I hadn't fought for a second opinion for my son after he nearly died, he may not have had a third surgery. And if I hadn't insisted on adoption instead of guardianship, my daughter would not have the services and support she needs now to heal from the trauma. Yes, we survived, but please don't mistake this as a story of success. My family did not survive because the system worked. We survived because we overcame a broken system. And that's why public policy matters. Caregivers should not have to depend on privilege, persistence, or luck to get the support that they need. Policy should be predictable and equitable. That's what creates a system that actually supports families, not exhausts them. Right now, caregivers across Oklahoma are doing everything that they know how to do, but they cannot keep holding up their families and our communities while the systems around them continue to break down. It's within our power to fix this, and Oklahoma families are counting on us to do it. Thank you for your time.
Thank you for sharing your story.
Thank you.
Next on the agenda, we have Mabu with our finance report. I think there's a PowerPoint. Sharing it.
Thank you. Good morning. I'm Mahbub Ulhaq, Business Manager for OCCY. Thank you very much for the opportunity to present the OCCY financial report as of October. My goal today is to provide a clear snapshot of where we stand financially, highlight the key spending trends, and ensure transparency in how our resources are being managed. And I will walk you through the budget utilizations, departmental allocations, and important updates for an informed decision. Let's begin with the financial year 26 budget snapshot. Our budget utilization is the overall, our budget allocation was 5.86 million as of October 31st. Our utilization is 1.158 million. This represents 20% of the total budget utilization. And if we see at year-to-date budget, it's 47%. This seems a low utilization, but the reason the lower percentage utilization is due to the timing factor. Most of the activities are planned for December and January. Large CAMTA fund disbursements is due in December and January. Some invoices, big invoices for the OU database team are pending, and that's front-loaded. Encumbrance for conferences are not yet utilized. So our spending is not underutilized. It's expected as per our planned activities. Now let's look where those funds have been spent. Personal services, 1.06 million utilized. That represents 64% of the year-to-date allocation. Administrative, 61%. Travel, 36%, which makes overall our disbursement up to date 1.158 million. Here's how this disbursement looked like in different categories. The total, what we spend, breaking down these expenses is 78% almost in salaries. Professional services are 14%, travel almost 2%, and administrative is 5.8 or 6%. And we have no utilization in the last category. Is basically mostly for the CAMTA fund disbursement that is due in December. Let's see our monthly spending trends. Monthly spend expenses have been steadily increased from July to October. Cumulative expenses up till now is 1.16 million. This steady growth reflects normal operational activities at OCCY, with larger spikes expected in December and January due to the scheduled disbursement. Let's review budget utilization by department. Administration and juvenile system oversight have utilized roughly 2/3 of their year-to-date budgets. Office of Planning and Coordination and ARB administration are also on track. You will see the large allocation under the MDTs. So it's on the lower side disbursement that I already explained this, that are planned in December and January. And there are few invoices that are still pending for the OUE teams in the IT department. So these two departments low less disbursement. Some accounts such as juvenile competency and Board of Child Abuse examination have not yet recorded expenses, but they are expected to later in the financial year. This is how it looks like if we see the visuals. So green bar shows the actual expenses up to date, and blue bars represent the total budget, and year-to-date budget shows by the orange bars. This is our department utilization by expense category. Salaries are the largest category in our expenses with $632,000 spent. Professional services are 34% utilized. Travel and journal operating expenses remain modest in this range. This is how it looks like if we see the graphs. Let's check our cash position. We have available cash balance in last year's appropriations, 273,000. For this present year, current year, we have balance of 177,000. Revolving fund balance, 307,000. Total, we have almost 7,057 in our cash balance. This shows our cash position is stable. All obligations are covered and there is no liquidity issues. Now, highlighting the key financial activities and updates in the OCCY, we have finalized the financial year 25 expenses and paid all payables, ensuring the transition to the financial year 26. Budget revisions are ready to carry forward the financial year 25 balances to the current year. CAMTA financial year 24 funds have been reconciled with the unused funds returned to the DHS. On compliance side, CAP packages submitted, P-card reviews completed, and that monthly reports are verified and discussed with the OMS ABS. Purchasing and contract management activities have been aligned. Operational support continues. Payments are up to date. No known issue and compliant issue. Finally, the following system-generated PeopleSoft reports are already included in commission packet for your detailed reviews. Finally, let's conclude the presentation. OCCY, in conclusion, OCCY financial position is stable with the spending aligned to the plan and major disbursement schedule for the coming month. I welcome your questions and feedback. And today's discussion may include the possible vote to the finance input. Thank you very much.
Is there any discussion, questions?
I just want to point out one thing. So you may have noticed that our travel is really low. If you remember, in July or June, when we voted on our budget, we said we were going to be really tight this year. So we're not going places unless it's necessary to conduct our business or, complete our duties. Unless somebody else pays for our travel, we're not going somewhere unless it's just in state to get things done or it's required by grants or something like that. So our travel is really low. It was 1.7%. I mean, I don't know that it's ever been lower. So you'll see that. And then the other thing is, I just want to remind you that over 95% of our appropriations, correct me if I'm wrong, will all be spent on salaries, leaving very little. I think it's actually more like 98%. It's really high. Leaving virtually $200,000 or so to cover rent and, utilities and the copier and our laptops and all of that, all of our overhead, much less anything that's optional. So the rubber's meeting the road this year. And while that is a good picture of what's going on, I don't think that it really captures how tight we're going to be, because it's October, November reports. And as the year moves on, you're gonna see things get tighter and tighter. And I just want to bring that to your attention and remind you why we asked for additional money for this year. Because we honestly cannot keep the lights on and everything else if we don't get more money. Right now, we're living on the graciousness of lots of you in the room through contracts. So thank you for your support and your assistance, but we're only doing duties as assigned by statute unless you're paying us to do something extra. So thank you for those extra dollars. And just be mindful as the year goes on, those numbers are gonna get tighter. So that's all. Just wanted to, Mabu painted a very nice picture and does a really good job of keeping us afloat. But I think that picture is gonna get more stressful as the year goes on. So I just wanted to point that out.
Well, you're at 75% on salaries and fringe now, and we're in November. So will it mean that you'll have to reappropriate
That
money?
was 75% of the year-to-date utilization of the budget. So we're actually underutilizing, but that's because a person or two has left and we have not immediately filled the position. So a slow hire in a vacant position, if you remember, that was one of our strategies,
Right.
was we may not fill positions immediately so we can absorb a little of that money.
Well, I would just say thank you for your leadership and management with, I mean, you're running a tight ship. But I would also just second the fact that this agency exists statutorily for purposes, for oversight and protection of children in our state. And thank you for managing it. But we've got to fund this agency.
Well, I'm gonna tell you, it's a dramatic difference to have Mr. Earl Hawk help us because we haven't always had his skill set in-house, and it makes a dramatic difference to be able to do things immediately on your own without having to rely on OMS to come back with information. So it's so great that we have you. I hope we can keep you for as long as possible. So it doesn't snatch you up, but it makes a tremendous difference. So didn't want to belabor that too much, but he paints such a pretty picture, and I just want you to know that it is gonna get tighter as the year goes on.
Any other discussion?
Jeffrey Cartmel has his hand raised.
Yes, Director Cartmel.
Yeah, just one quick question, and based on Annette, your comments just now, one of the earlier slides in that presentation reflected a steady increase month over month in expenses. Do we anticipate that to level off at some point, or do we anticipate that to continue to rise as the year goes on?
Great question. So I think it depends on what activities and which months we're talking about. So I think Mr. Earl Hawk was kind of pointing out that we've got a plan of activities, and some of them, are all going to happen in this month or this period. So it may go up and then it may not go up depending on what activities are planned. So I don't think that we're going to see a gradual climb for the rest of the year. That is not anticipated.
Thank you.
We can vote to approve. No other discussion.
We need a motion.
A motion.
So moved.
You have a second?
Second, thank you.
Commissioner Aaron,
Yes.
CEO Bullard,
Yes.
Director Cartmel,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Curve,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
I'm also a yes.
I got you.
Did she say it?
Commissioner Whip, did I say it? I didn't say you, I'm sorry.
As.
Next on the agenda, we have Richard for discussion. Vote. And I believe that is in your packet. The resume that we're looking at is in your packet.
Good morning. I'll give you a brief overview about the the OCCY Juvenile Competency Evaluation Professional Committee, which is kind of the prelude committee that this process today about approving a psychologist to be fully approved to provide competency testing for OCCY. And I've included some information about the statutes and also the administrative rules that require a committee before it ever comes to presented to a vote to the full commission on approving someone to be a juvenile competency evaluator. And in this process, we have a committee that reviews the psychologist who's gone through kind of a, I would say, kind of a heavy vetting as far as being evaluated. They do what's called provisional evaluation before they ever are recommended to be approved to the commission. And over the last year, since January 16th, we started with one full-time juvenile competency evaluator. And in that time up to now, we've had 3 approved. Today, we're going to have a fourth psychologist recommended for your approval. And I wanted just to kind of tell you that there's some of the committee members that we have on this group, and they provide various perspectives as far as the psychologist. We have an assistant district attorney on this committee. We also have a judge and also a defense attorney, and also a specialist in special education who has a background working with juveniles as well. And so anyhow, I wanted to kind of give you a brief overview of what the process is until it gets towards presented to the commission for full-time recommendation. Our fourth one for this year is Dr. Paulette Pitt, and she has completed the provisional evaluation. And there it is. She has completed the information is in your packets. The provisional evaluation and her report has been reviewed and approved by the Juvenile Competency Evaluation Professional Committee to be sent to the commission. And so what I'm doing today is presenting her name to the commission for your approval for her to be a juvenile competency evaluator and work full-time, or basically help us with juvenile competency testing.
Any other discussion or questions? If not, we can have a motion to approve Paul.
Commissioner Aaron,
Yes.
CEO Bullard,
Yes.
Director Cartmill,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurt,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
Commissioner Whip.
Yes.
Motion passed.
Motion passes. All right, next we have Director Jacoby for her recommendation for child abuse training and coordination counts.
I'm presenting a name today because Ms. Gasner, who's over this program area, is out today. In your packet, you should have a resume for Brooke Christian. She's going to be representing CLEAT on that board, and I'm happy to entertain any questions if you have them.
Happy for motion. There's no other discussion or questions.
Commissioner Aaron,
Yes.
CEO Bullard,
Yes.
Director Cartmill,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurt,
Yes.
Commissioner Larison,
Yes.
Commissioner Michael Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
Commissioner Whip.
Yes.
Motion passes. Next, we have proposed meeting dates. So if you want to look at calendars for 2026 meetings. If there's any conflict or discussion. We changed it around in the past. Go ahead.
I just want to make a comment. You may think the cadence of this is really odd. In some ways it is. But there are certain things we have to do based on statute that we have to get approved. So it makes the timing kind of awkward. So it's not every other month perfectly or anything like that. So, we always have to have, there are recommendations that we're supposed to have to you by May. There are June, budget request or budget that we have to have approved and in place. So anyway, some of those dates look kind of curious, but it's usually due to a statutory requirement.
Happy for a motion if there's no conflicts for the proposed 2026 dates.
Motion.
Thank you. First and a second, and then
Commissioner Aaron,
Yes.
O Bullard,
Yes.
Director Cartmel,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurt,
yes.
Commissioner Larison,
Yes.
Commissioner Michael Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
Commissioner Whip.
Yes.
Motion passes. Motion passes. Thank you. All right, next we have Elizabeth with a presentation on the Child Death Review Board overview.
Morning.
Good morning.
I'm Liz Kopp. I am the program manager for the Child Death Review Board and here to present the annual recommendations for this year. Before I do that, I'm going to spend a little bit of time giving some explanation of the Child Death Review Board. And so I will start there. Child Death Review Board was established in 1991 when the Oklahoma legislature recognized there needed to be multidisciplinary review of child death cases in Oklahoma. So it is housed here at OCCY, of course, and the cases that the Child Death Review Board reviews are all of the homicides, suicides, accidents, undetermined cases, and natural cases only when there are allegations of abuse or neglect. And we also review COVID cases for statistical data collection. And we do this to submit all of this data that we collect. We also do near deaths that are referred to as child welfare. I don't want to leave that out. It's very important, especially for later. So we do that. We enter all of that data into a national database where it goes to the CDC, and then we use that data to make our recommendations and put out an annual report, which will be the first that we've done. That is a cohort year of data. We have not done that in the past, and I'll talk a little bit more about that a little bit later. And the last one on here, recommending policy, practice, and improvements. That's not something that we were able to do historically with as much intention as we would have liked because we didn't have cohort year data to work with. It would be a year's worth of data could have been cases that we closed 5 years ago, 10 years ago, just last year, all over the place. So now it's going to be all of 22, all of 23, all of 24, and we can do trend analysis with that. So these recommendations that I'll be presenting are late, which you all probably are aware, but we are overhauling everything about the process. And it's been an extraordinary amount of work, but we're pretty excited about where we are now and how far we've come. So this is the first year that our recommendations are based on a cohort year of data. They're based on 2022's deaths and near deaths. And next year's will be on 2023's and so forth. And then when presenting the recommendations, they're not just going to be what we'd like to see happen or support, but an implementation strategy that we won't be talking about today necessarily, but it's what we will be working under. And then we will be tracking our progress and including that in subsequent national or annual reports. And that is all new to us. So it's been quite an experience. This map here shows us the cases are reviewed. So in the middle of the state, the three counties, Oklahoma, Cleveland, and Canadian counties, that makes up our state board. They meet every month. And because we don't have a great population, it would be difficult to make quorum. They also review all of the cases for the Northwest team. So we consider that part of our state team. Then the blue, green, and yellow Eastern team, Southeastern team, and Southwestern team, they meet quarterly, and we go to each of those areas of the state to meet. And our Tulsa team, because they get about as many cases as state team does, we meet with them every other month. So our process is that we are notified of a death. I'll get to the near deaths in a second. We're notified of the death by either receiving the autopsy from the OCME office, the medical examiner's office. We receive the death certificate from Vital Statistics or an initial report from Child Welfare. Once we receive that initial report, we start working to request the remaining documents that we need to compile all of this information so we can condense it into a narrative that we then enter into SharePoint or into the database for the board members. We assign cases to the board members, and then during each meeting and executive session, the board members take turn presenting the cases to the rest of the group. And then the board will answer subjective questions along the topics of supervision, whether the child had supervision or they needed supervision or they didn't need it because of their age or developmental age, whatever. We talk about the maltreatment, which is going to was child abuse, child neglect, poor or absent supervision, or exposure to some sort of hazard, part of this case. And then last but not least, the preventability. Was this case preventable? Probably yes, probably not. About 93% of our cases-ish in the 2023 data were considered preventable. The near deaths are very similar. They don't go into the national database. We have our internal database where we collect that information. That comes to us from, again, child welfare. A near-death case is if the child is in critical condition or serious condition as certified by a physician and due to allegations of abuse or neglect. So there are near-death cases in the state, but because there are no allegations of abuse or neglect, we would not get those cases. And yeah, pretty much covered all of that. After all of the information is entered into the database or the initial information, and then the board members vote on the things that I just mentioned. We have an internal data entry person, Christina, who goes in and enters all of the data points on each of these cases, which is extensive. It covers absolutely everything. The parents, the caregivers, if it is an infant, if they had prenatal care or not, the mom's maternal history, the circumstances of the death, just absolutely everything. So that is a lot of work, and having a dedicated data entry person to assist with all this has made a huge difference in where we are today, which I'll bring up again later. It might be a little bit hard to read with the small writing. These are the causes of death for 2022. At the bottom of the list that has the longest bar, that's gonna be the motor vehicle deaths. Just above that, we have undetermined, and then a few above that, asphyxia. Both of those categories are what make up the unsafe sleep cases. If it is accidental asphyxia, it'll be under the asphyxia category. If under undetermined, that's going to be the sudden unexpected infant death cases, which is an umbrella term that covers SIDS, which we don't really use in Oklahoma anymore. SIDS is kind of a unicorn, is how it has been described to us. That's going to be where there are, after the investigation is completed, there are absolutely no unsafe sleep factors and no real understanding of how the child died. In these sudden unexpected infant death cases, the vast majority of them are because of unsafe sleep factors. And then ones that are not unsafe sleep factors are going to be something along the lines of a cardiac anomaly or other internal issues like human metapneumovirus and other things that littles can get that might also contribute. Bodily force and weapon on there. So the weapons, another big category here. These are what are driving our recommendations for this year. Bodily force is going to be like abusive head trauma or other kinds of physical abuse that led to a child's death. The rest of them are the weapons, and the majority of the cases that fall under that category are weapon related. I have some stats, so I'll mention them when we get to that section. Medical condition, that is not part of one of our recommendations this year, but just to give you some information, that's going to be mostly medical cases where it's medical neglect, where they were not handled or treated by the caregivers. And there are also the ones that are considered not preventable, generally fall in this category, just cognitive or medical or cardiac anomalies. I knew I was going to get to that word. That kind of thing, and just other things, congenital issues that you're born with and you have a short lifespan because of it, are going to fall under that category. This doesn't cover the near deaths. I'll talk a little bit more about that when I talk about that particular recommendation.
Next slide is, how is suicide factored into all of that? Because I know I get the ME's reports in all 4 of my counties. It seems like we've had a lot of suicides, adult and even kids. Is that factored in here somewhere?
Yes, that's a great question. The suicides are going to fall under the weapon category here, and they're also going to fall under the asphyxia category. They're going to fall under the poison and overdose category. I'm not sure about the fall or crush. In previous years, that has fallen under that category as well. It is not one of our recommendations this year, but it will pretty much certainly be on next year's recommendation list because it is such an issue and it's a problem.
Why do we not use the term SIDS in Oklahoma?
It's mostly an outdated term. We've become to understand over the years that after the investigation has been completed, there are either external or internal factors that contribute to the child's death. In a true SIDS case, they don't find any external or internal factors, and that is extremely rare. Overall, like nationwide, that term does still get used a lot. And even here in Oklahoma, a lot of people use it because it's just what has been around for so long. But the true, what we are seeing is sudden unexpected infant death or sudden unexplained. They get kind of used interchangeably. Part of the reason I mean like nationwide, have such a difficult time getting the safe sleep numbers reduced is because even us as professionals aren't always in agreement on what to call it or what causes it. And it's just one of the many factors of why that number has plateaued over the years of these kinds of cases.
Thank you.
Okay, so now we're gonna get into the 4 recommendations from this year. So in 2022, Child Death Review Board reviewed 299 child death cases. And of those cases, 15% of them, or 46 deaths, were related to firearms. So breaking this down a little bit further, and you have this information, I think, in your packets. 3 of these firearm cases were unintentional, and in all 3, the child accessed an unsecured firearm. They were all young, well, mostly very young, some of them very, very young. 17 of these cases were suicide, and in 12 of those 17 cases, unsecured firearms were the factor. In 4 of those, we did not have information on whether the firearm was secured or not. With suicides, unfortunately, the investigations are not always super thorough. Most of them are not referred to child welfare. We get a huge amount of information from child welfare investigations because they go in and they do this deep dive with the family. And the law enforcement approach with suicides, from what is reported back to us, is that once they establish that a crime has not been committed, sometimes the investigation is fairly open and shut after that point, and there is a lot of questions that aren't answered. And so then that leaves a lot of unknowns with our data. Not always the case. Sometimes we get some very thorough, wonderful investigations, but it's not the norm. Then we have one that was poorly secured. And the reason I say that, it was a 10-year-old who had broken into a lockbox with a butter knife. And I feel like if you're breaking into a if you're breaking into a lockbox with a butter knife and you're only 10 years old, it can't be a very good lockbox and not the greatest secure. 25 of these cases were homicides, which made up 82% of the total homicides for Oklahoma that were the CDRB reviewed. Now, out of these homicides, 10 of these don't really fall under what we're looking at today as far as the recommendation, because it was the adult caregiver who committed the homicide, one of the parents or an aunt or uncle, that kind of thing. But the rest of them, in 15 of these cases, we don't know exactly how the gun was obtained because of the circumstances of these homicides. A lot of them had to do with criminal activity, gang violence, going to a party where there's a lot of drugs and playing with firearms, showing off, pointing them at each other, check this out, playing Russian roulette, all sorts of unsafe handling of firearms. Then we have robberies, and that could be where like the teenager has broken into a home, or it could be wanting to go buy or sell a gun or marijuana or other drugs and then robbing the gun dealer and then that going bad. A lot of those kinds of cases. And then fights, fist fights that turn into gunfights, that kind of thing. In a lot of those cases, we don't know where the gun came from. With the suspect, we don't know where they got it. And then one of the cases was an undetermined manner of death. These were a couple of adolescents that had access to an unsecured firearm, and one shot the other, and they don't know whether this was intentional or not. So this was considered undetermined. In addition to this, we reviewed 6 firearm near deaths, and 5 of those were unsecured firearms. And in those cases, the child lived, but of course, some of them had, lasting damage depending on how they were shot, that sort of thing. So national context and comparison. As of January of this year, 27 states and Washington, D.C. have implemented child access prevention laws or safe storage laws. And that means that a CAP law, for short, child access prevention law, allows prosecutors to impose a criminal liability on adults if a child gains access to an unsecured firearm, or if a firearm is stored in a manner where a child can access it or is likely to access it. Oklahoma, as you could probably guess, does not have such a law. And in addition to that, as far as the laws, Oklahoma is considered the most permissive of firearm laws. The only the laws that we have here are if an adult provides a firearm to a child to use, and then that goes south, then that could be charged. And that's considered the most permissive. So there is research out there, Johns Hopkins, Rand, that has a lot of research and stats on these child access prevention laws, shows that states that do have these have reduced suicides, homicides, and unintentional firearm deaths. And CDRB is very well aware that Oklahoma is is probably likely to be hesitant to push forward this sort of legislation. But I do want to say it's not about politics, and it's not about infringing on anybody's rights. It isn't about telling people they can't have guns in their home. Most people in Oklahoma probably do, but it's about making it as safe as possible so we're not losing as many children as we are, because our stats are higher compared to the rest of the country. And, you know, it's the bigger picture, it's protecting our children. So one of the stats that I have highlighted just to bring to your attention, between 2003 and 2021, and this is nationwide, firearms used in unintentional child injury deaths were found to be loaded in 74% of the cases and unlocked in 76% of the cases. So if we were able to at least get some of these locked up, maybe our numbers would go down.
It's also just a misdemeanor if they get caught with one. If a juvenile, even after adjudication, gets caught with a firearm, it's a misdemeanor. They don't even come into custody. So it's basically a city ticket if they get caught.
Not a lot of deterrence.
Yeah, and we'll have, I mean, I had a kid come in and it always sticks in my mind that came in and said, well, if there's a pickup truck in a parking lot, it's got a gun in it in the state of Oklahoma. So he said, all you gotta do is look for a truck. It's got a gun in it. So like to break a window.
Yep.
And then get a city ticket slap on the wrist. Yeah, they have them. They all have them.
They do. And a lot of our cases took place or were guns that were found in vehicles, or whether it was, you know, they got access to the vehicle when nobody was inside, or, you know, mom or dad went into the store and the kids were out in the car and accessed the vehicle. I mean, we've seen it all. Okay, the next recommendation is on initiating safe sleep education during the prenatal period. In 2022, CDRB reviewed 76 cases that were related to the sleep environment, which is 25% of our cases, 1/4 of them. 93% of those cases were occurring in children under 1 year of age. And the vast majority of them are preventable. Nationally, in 2022, 3,700 approximately suicide deaths occurred. I just went to a training where they equated that to, how did they put it? It was several kindergarten classrooms. The image, no, I'm not going to say that right, so I guess scratch that. But the visual that they put up on the screen, just showing how many of them, was rather alarming. 31 hospitals in Oklahoma currently provide safe sleep education through Cribs for Kids, National Safe Sleep Hospital Certification Program. It was kind of challenging finding information on what hospitals were providing safe sleep education. But it could be more than 31, but at least according to the stat. The problem with that is after the baby's born, there's a lot going on. Mom plus whatever other family's there is going to be exhausted. They have a whole lot of information being given to them at the same time. And trying to figure out, you know, get baby home and what's life gonna look like? Do I have everything I need? If I sleep, all the things. And if we were able to start providing this education during the prenatal period, and that is something that we're hearing consistently ahead of just, you know, when you're exhausted and got so much else going on, it may stick a little better. Now, granted, there are a lot of other reasons why that trend has not declined anymore in the past 25 years, but this could be one of the things that could potentially help. American Academy of Pediatrics, you've probably all heard ABC, alone, on your back, in a crib, and the additional things, fitted sheet, no blankets, no stuffies, don't prop bottles, breastfeeding is helpful, don't smoke, all the things. Providing this education as early as possible could hopefully help it sink in and stick a little better. So we're hoping that by doing that, that will reduce some of our numbers. We have some of the highest in the country. I think we're 7th. Yes.
Do we have any data or know how many of these deaths would have had access to or utilized prenatal care prior to the events?
Yes, to a degree. We do track that information when it's available. It depends on the quality of the investigation, if that information is asked. But those are all the data points that we collect. How many prenatal visits they had, what kind of history, all of the above.
Does that information show that this could have an impact by having access at prenatal? Does that make sense?
It's hard to say because we're battling also, you know, cultural reasons why, availability of bassinet or crib or pack and play, just exhausted parents. Also risk perception is a big one. Everybody, I shouldn't say everybody, that's not poor wording. It's common to see parents and caregivers have that mentality that it won't happen to me. I co-slept with my other kids and they're all fine, but it's one of those things that it's fine until it's not. And then when it's not, you can't take it back. And
My question was similar. Are we asking those questions at well child checks? Like, are these parents getting asked, where is your baby sleeping in your bed?
another, yeah, well, one of
We don't
our,
know the answer to that.
yeah, we don't know the answer. One of our board members who is a pediatrician, because he sees this, you know, in our meetings, is very cognizant of it, but as far as across the board. No, it is also, sorry, documented in when child welfare goes out to investigate, and that is helpful. That's one of the things that we get that information and we can document.
Initiates the safe sleep programs.
Quite a few entities around the state are doing that, preparing for a lifetime. Jasmine actually just compiled this whole list of places that are providing education and training, and there was some places on there that I was not familiar with even. That's part of what we are working on as far as our implementation strategy, is to compile all of that information and figure out how we can work with them to.
I was just curious if the rural areas were.
That's one of the struggles for sure, is in rural areas, and the message does not appear to be as consistent in rural areas as it is in some of the main hospitals. And
There are fewer rural hospitals now,
Yes,
so it
there
seemed like
are.
it'd be easier to
And some of them
cover than it.
closed recently too. Okay. Recommendation number 3, strengthening the child passenger safety laws in Oklahoma. This one is hopefully less controversial, but it has also been presented in legislation and it has not gone through multiple times. So Oklahoma is the only state in the country that does not have a law where a child in the back seat over 8 years old does not have to wear a seatbelt. Let that sink in for a minute. It used to be in the law, and the statute was rewritten some years ago, when they were rewriting it to require rear-facing car seats, and then this part got left out and didn't get put back in. And there have been multiple attempts since to get it re-added, and it has been shot down every time. And as you saw from that first slide I put up, the motor vehicle deaths are among the highest of what we see. And so I have some numbers as far as unrestrained backseat passengers. So of the 299 cases that CDRB reviewed in 2022, 65 of those cases were due to motor vehicle accidents, which is 22% of our overall. The child was the backseat passenger in 22 of those cases. So the ones that don't fit in this category, this is going to be like the teenage drivers, or sometimes, unfortunately, not teenage drivers. We also have front seat passengers who don't qualify, and then motorcycles and pedestrians. They fall under this category if a pedestrian is struck by a motor vehicle, and then a couple of like sleds and other things that were struck by motor vehicles that don't really fall under this category. So that's why the numbers might look a little odd. So out of the 22, 18 were completely unrestrained in the backseat. 2 more of them were inadequately restrained, which means like they were only wearing a lap belt when they should have had on a shoulder harness and a lap belt, or they had the shoulder harness, but it was like propped up behind them, thing. And then in 2 of the cases, restraint use was unknown, and because of the nature of the collision. But because of the information that we do have, it suggests that they were not wearing a seatbelt, or they were either improperly or not wearing one. So Oklahoma is 44th in the nation for seatbelt use. That's for everybody, but of course, being the only state that does not have a law for seatbelts in the back seat does not help that. And then you put turnpike or highway or even rural driving to that list where there are likely excessive speeds and you're not wearing a seatbelt and you have a collision, and you end up with a part of this data. Like the firearm one, the cap one, there are active bills for this that were presented and are still active. But this is, of course, something that we want to see happen. So last but not least, now we're jumping on to the near deaths. In 2018, medical marijuana was legalized in Oklahoma. In 2017, CDRB reviewed 0 cases of ingestion due to THC edibles or some other form of THC. And in 24, that number has jumped up to 24. Out of all of the near-death cases that CDRB reviewed in 2022, which was 112, 53 of those, just under half, were due to some sort of poison or overdose. And of those, 24 of them were related to THC. It's become such an issue that our state board is in conversation now of creating a subcommittee just for these cases, because we can't have a meeting without having multiple THC ingestion cases, each in every meeting. And the story is always the same. So, there are only 9 other states, at least as of the most recent information that is available, that do near-death cases. And of those 9 states, most of them don't break them down into detail like we do. So it's hard to say exactly where we fall as far as the rest of the country. But overall, we're up there, we're up high. And right now, the language on the medical marijuana packaging is, it says, a warning that this product is for medical use only, instructions to keep the product out of reach of children, and a caution for pregnant or breastfeeding women. CDRB feels like the general population does not have a good understanding of just how dangerous it is for littles to get a hold of these edibles. And what happens? They stop breathing, they get admitted to the pediatric intensive care unit, they get placed on a ventilator, they have seizures, they go completely unresponsive, respiratory failure. When you don't know what's happened when you're home with your kiddo and your kiddo falls out for no good reason, and you take them to the hospital, and the hospital in almost all of these cases ends up, the local hospital transports them to either St. Francis or OU, and they end up in the PICU and on a ventilator and all the things listed here, or at least some combination of these things. Can't imagine how terrifying it is for parents and caregivers, and let alone the child. And while we haven't had any deaths yet, what happens when the response isn't quick enough? So what CDRB is proposing is that we would like to encourage that the Oklahoma Medical Marijuana Authority amend the packaging to include stronger language written, and by stronger, I mean, and to include some of this in using language to make it accessible to all readers. You know, instead of saying ventilator dependence, we would say help breathing with a machine, that sort of thing. And hopefully, as word gets out, this is just the first step maybe of maybe helping to educate everybody, the population more. We can secure this a little bit better than it is now, because right now it's in a drawer, it's wrapped up in a paper towel in mom's purse, or it's even on top of the refrigerator. And you know, anybody that has little kids knows that little kids like to climb, and we need better everything when it comes to these kinds of cases.
Was there discussion regarding a recommendation to like limit the amount of THC that's in edibles? You know, because there's, I believe it's like unregulated, or
Yes.
so you can have a small little gummy that might have a very low dose, or that same small gummy might have a tremendous dose that would
Yes.
put a child in the PICU.
That's a really good question. When we started all of this conversation, we hadn't gotten quite that far, but other states who don't have near the issues that we do with this, they are cognizant of that, and they have like individual packaging that makes it harder for a kid to say, oh, look, you know, there's a bunch of candy, I'm gonna eat it. So that would probably fall into like next year's recommendations to kind of expand on that. The thing. I mean, I don't want to speak for the board, but
I just want to add, there is a work group that years ago, we started a work group, and it continues on through OMMA. And they are looking at recommendations like that. I think they're trying to figure out, is it palatable to the industry, and how to negotiate those things. So it is ongoing, and because it's not included here doesn't mean it's not being entertained.
Last but not least, this is our CDRB team, and they're a huge part of why we are why we are where we are right now. When I started almost 6 years ago, this year will be, or this spring will be 6 years, we were closing cases that were years and years old because we didn't have all of these people who were able to do all of what we're doing right now. And we have made so much progress in these last few years. The boards also have been tremendously helpful, having either subcommittees or holding extra meetings, special meetings, I mean, and just working really hard, covering cases for members who are absent at a meeting. The bottom two, I just want to shout out Andrew Long and Vivian Sanchez are our current two graduate students from the OU Hudson College of Public Health. And they have been just beyond instrumental in doing amazing things for CDRB, things that we've never had before. Andrew is writing code to be able to take our previous years of data and turn them into cohort years so we can republish annual reports with cohort years of data and do trend analysis. And Vivian is creating this dashboard to where we can look at specific things in the data. And they've both been just super helpful with, the case management process of everything that we're doing. And then Jasmine, I don't know have y'all been introduced to her yet? Okay, Jasmine is our new injury prevention coordinator. We've never had this position before. And, but we've never been able to take our data and do things in real time with it like this. So once Jasmine is fully trained, she just started with us in October. And when she's fully trained, she's going to be going out and providing training and education to all different types of audiences on everything that we're seeing in the data. And she has a lot of experience with this already, and she was the perfect person for the job. I know this is such a cliched thing to say, but she really did hit the ground running when she started and has already made all these connections, and we're just super happy to have her. And so I'm very thankful to be a part of such a great team who've helped us get to where we are. So I wanted to make sure to highlight that too.
Thank you, Liz, for your tremendous work on this. I've been here, this is my 7th year, so to see data in real time is incredible because I remember the backlog and it was years later. So I appreciate your team and all that you do.
We're actually closing some 2025 cases. We started with a couple of the teams, and then our upcoming meetings will be also amazing. Like same year. It's mind-blowing to us.
Thank you. Next, we'll have our legislative agenda update.
Good morning, Marsha Johnson. We have 2 bills on our legislative agenda for your consideration this morning. The first one deals with the Office of Juvenile System Oversight. There are 2 components to this bill. The first one is that we would authorize the office to subpoena records from facilities, entities within the Children and Youth Service System. Currently, the office has the authority to subpoena witnesses and hold public hearings, but they don't have the authority to subpoena records, which doesn't really make any sense. And this gap in authority was highlighted a few months back when OJSO was conducting an investigation of a complaint, and they needed records from a specific facility, a certain facility and tried to get copies of those, and the facility said, not without a subpoena. So that kind of really highlighted the gap that has existed, I guess, since this was first enacted. The second issue also came about as a result of an incident a few months back. It would be authorizing the office to disclose the identity of an individual who makes a complaint to the office, and somewhere along the line, that person threatens to kill or seriously injure an identified person or and I copied this language from the Board of Psychologists, a reasonably identified person. And in this case, the person was clearly identified. But the commission doesn't have the authority to, give a heads up, and only a court can order that disclosure. So we're trying to kind of remediate that issue. I don't know how often it happens, but when it does, it's a scary situation. So basically, it's very simple, but this is the first bill for your consideration.
On the language with regard to the disclosure, it's either communicating to the person threatened or to law enforcement. Am I reading that correctly?
Yeah, and I think that the second part of that would be if the threat isn't specific to a person, but maybe there's a broader threat or a vaguer description, to be able to notify law enforcement in the community where this threat's being made.
Yeah, for example, if it were an outfit or an agency, so if we heard that someone was gonna go on a shooting binge at a particular place, we might call law enforcement as well as that entity, but it wouldn't be a person that was identified, it would be an entity.
Well, and my concern is actually the other way around, is should we be
Oh,
telling the identified person or just law enforcement and letting law enforcement then take care of it from that point forward? That would be the fact that we're disclosing information to another individual that has been threatened, I think actually could pose additional risks, rather than simply notifying law enforcement of the credible threat and letting them handle that. That's just my thought in looking at this.
so in this particular situation that we dealt with, that person wasn't in their usual typical locale. So it was helpful that we could actually notify this individual and not, and I'm just gonna be honest with you, we ended up, because we were so worried, we did contact this person, because they were a person that the community knows. And we were worried about that happening. And I just decided to err on the side of caution, and I thought, come get me if you need to, but I would feel horrible if something had happened to that person and we hadn't notified him or her. So it was good that we could find that person, because that person was not in their typical community, and that way they were safe, or at least knew to be on the lookout. So that's the only reason I would give a little pushback on not notifying an individual, because we didn't know exactly where he or she was at the moment. But that's a good point.
Well, and maybe the or is what's catching me. And so maybe it needs to be to the extent that we are going to notify law enforcement and
And if necessary.
reach out and then communicate with the identified individual. Like, I can see a circumstance where that might be necessary, but I would want to make sure that we are at the minimum notifying law enforcement, and not have it as an or. Does that make sense?
Because you would at times want to do both. Not just have to choose one, right? So it'd be and or.
Well, I think it has to be, you have to do the notification
Have to
of
notify
law enforcement. And then if
choose to notify the entity or individual. And I do think you mentioned that this comes out of the APA or the Psychological Association.
The psychologist licensure board, the statutes that govern them.
Yeah. So that's precedent goes back decades, you know, if somebody tells the psychologist that they're gonna kill somebody, then you have to take reasonable and appropriate steps to identify that person.
And Director Cartmill, did you have a question?
That was my question. It's already been addressed, I think. Thank you.
And maybe tying the individual to an imminent threat type of situation.
You want to add the word imminent before threat? Okay.
Yeah, I think it's the identification to the individual would have to be tied to an imminent threat rather than just an amorphous threat.
Well, and the statutes, and I believe you have the drafts of both of these bills that we're discussing in your packet. And the way it's written, it states communicated an explicit threat to kill or inflict serious bodily injury.
Which is different than imminent.
Yeah, and maybe it's just the lawyer in me. The explicit is, yes, this is a threat. It's clear they're threatening. Imminent would be, this is something that's going to occur very soon, and if we don't take action to immediately notify. That's where my thought goes in, but that's.
I do too. We use that word in child welfare, imminent.
Yes.
Can I ask a question? So, just thinking back to law enforcement, and Mr. Mowdy, you may want to contemplate this a little bit. My only concern with having law enforcement identified first as opposed to the individual person or entity would be that it is widening the circle of people who know something that we generally cannot share. And so we want to keep the confidentiality of any reporter and take that very seriously. And the only reason we would break that confidentiality is because of a fear of a threat. So when we notify law enforcement, I don't know that they have a duty, duty to keep anything tightly known I'm just thinking about that, right? So let's say it's a small community where a lot of people know each other and law enforcement gets notified, and whether anything comes of it or not, are we then creating a information circle or knowledge that we would hope would not be shared outside of our routine process? It's just something to think about. And if we just notify that one person and they do what they feel like they need to do to keep safe. I don't know. I'm just throwing that out there because that is a thing I worry about.
What the threat is.
Yeah.
I mean, if I pick up the phone, I mean, we're dealing with in Stevens County right now, a guy picked up the phone. He's in jail for threatening a couple of assessors who were out to assess property. He goes to jail, he picks up the phone, and while he's on the jail, he tells his wife, I'm going to effing kill them. What are we gonna do?
Yeah.
We're gonna pick up the phone and call them immediately. And I don't wanna get in the spot where we're going, well, it has to be an imminent threat. Well, who's gonna make a decision that's imminent? I think there's an obligation to tell that person that there's been a threat made against your life and to let law enforcement know, because it is a crime to make that threat. Now, whether it's a joke or not, let law enforcement have it and make decision. I mean, I think most law enforcement agencies are smart enough to know, hey, if this is juvenile that I'm dealing with, they understand the confidentiality situation with that. So I'd rather err on the side of letting people know and letting law enforcement know and letting law enforcement do their job than just saying, okay, we're just gonna identify the person that's been threatened. That person, and of course, that person could go to law enforcement right then anyway.
Right.
And say,
Yeah,
They
but then that's
communicate
to me, that's their prerogative, right?
But, I still think, we've got child abuse, we've got reporting requirements in a whole bunch of different areas. And I would think if somebody's communicated a threat to take the life of someone else, there probably needs to be an obligation to let law enforcement know.
I'm not an attorney, but I am a licensed professional counselor, and I've had to call people because I did suicide and homicide assessments for 20 years. And it's the duty to warn is the issue, and the precedents established in the Tarasoff case from 1974 or 76, which allows you to breach confidentiality. And so I think there's precedent that allows you to breach confidentiality. But I do think there's also language that's existed for decades regarding duty to warn. And here it talks about an credible and imminent threat. But I do think there's language that exists that would cover a person's ability to address and fulfill their obligation to warn. That duty to warn would be the obligation.
Well, if somebody wants to modify it, they can, and we can vote on that modification. We're happy for that. I don't hear any pushback for the
Right.
actual concept. It's how to word it.
Right.
We want a motion to edit what we're wanting to propose.
So on the fly, my edit would be to change it to A, notifies an appropriate law enforcement agency in the vicinity where the complainant or any potential victim resides, comma, and communicates I would say imminent threat. I understand that there's a current objection to that, but that's what I would, communicates an imminent threat of death or serious bodily injury to the reasonably identified person, period. The key differences being and adding imminent threat of death.
We have a second to that motion.
If I could, I wouldn't have an issue with it, didn't say imminent, because I mean, the whole question becomes who's gonna make a determination whether the threat's imminent. And it already says, it already has that, some language in there. As an explicit threat, so I mean, there's a little bit of obligation to make sure it's there, okay. I would second it if that one position went there. I think the and is a good idea.
And the only room for credible, I mean, instead of imminent.
I think that's where the explicit comes into play. But if we wanted to change that to communicated a credible threat to kill or inflict, again, and I think this is where for a licensed professional counselor, there's an idea that you have an understanding in working with this client about whether the threat is credible and imminent based on that experience and that
Actually,
interaction.
if this, also, it's just if you're manning a mobile crisis line and a person calls in, because the issue is somebody calls in and says, I'm gonna blow up the world. They're making an explicit threat, but it's not credible.
Right.
If I just want to weigh in for a second. You make a good point in a way, though. The word credible for us, we have no way, in some instances, we won't have a way to know if it's credible. So, you know, people make threats. I don't know if they have a weapon. I don't know how close they may or may not be to that person. I don't know if they have a vehicle to get there. So we're a little hamstrung on knowing the actual credibility. And I guess that may be why we chose the word explicit. So someone makes a very, you know, very clearly understood threat against a person or entity. I just, and I guess.
I didn't choose that word, that this is.
Yeah.
This is verbatim from the Eighth Psychological Association.
And now that we're talking out loud, an identified person doesn't even really capture everything that I might be worried about because.
You mentioned agency.
Because agency, because we have had an instance recently where we've had a complainant who has done things to the facility or a building of a place that was threatening and scary. And you know, that agency obviously could take care of themselves because they knew about it. But had we known about it before it happened, it might be something that we may have wanted to warn someone about. And we didn't have a name associated with it. We had the name of the actual agency or facility. So I'm just now, as we're processing, it's always good to talk out loud. Thinking about that language doesn't include necessarily that kind of situation.
Given the D.A. Hicks commentary, I'm happy to amend my motion. Do we want to also change it to reasonably identified person or agency and then remove the imminent aspect, but have it as an and?
I would say entity.
Entity, okay. Person or entity or agency or entity.
Do you still want the word imminent in?
Well, given the current objection to that particular word and the fact that nobody is willing to second, I will remove that image from that. From that request. Yes, I'm happy to read the room. So that would be, do you want me to restate it verbatim how I?
Probably, that'd be
Okay.
good.
So I would modify my motion to change the wording to the disclosure of such information is needed to protect the safety of others if the complainant has communicated an explicit threat to kill or inflict serious bodily injury upon a reasonable identified person or entity. Period. The office shall be deemed to have taken reasonable precautions if it makes a reasonable effort to take the following actions. A, notifies an appropriate law enforcement agency in the vicinity where the complainant or any potential victim resides, and B, communicates a threat of death or serious bodily injury to the reasonably identified person or entity, period.
So do both if possible, is what I'm hearing.
Yes.
Okay.
And I do wanna point out that this language that goes over to the legislature, once it goes over there, it's out of our.
Yeah, absolutely.
Right. Not that they don't, I mean, they care, obviously, but the staff attorneys over there can make a change, somebody would approach the author and say, I don't like this, so.
Yeah,
But all we have control over is the language that goes over there.
absolutely.
And I'll second the motion.
We have a first and a second, and we'll vote on just this.
Commissioner Aaron,
Yes.
CEO Bullard,
Yes.
Director Cartmill,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
Pass. Motion passes. Okay. Move on to the next one.
Okay, so the second bill relates to the Children of Incarcerated Parents program. And we have 4 components in this draft. The first is essentially cleanup language. We're just making some modifications to reflect the way the program works in reality. Sometimes when they draft these laws, create these things, they don't really know how they're going to play out in real life. So the first one is pretty innocuous, making minor changes to that.
Just for clarification, we did discuss with Director Millington the idea of removing OJA from that process, so she's good with it. I just want everyone to know in that practice, in the beginning of the statute, when it first came into play, they were gonna identify kiddos that needed that mentoring service, send it to us, and then we would work with Big Brothers Big Sisters to ensure those kids got a big sister or big brother. In actuality, they may or may not have a program where they may need that need. So what has happened is Big Brother Big Sisters looks for kiddos who have a parent who is incarcerated or is at risk of being juvenile justice involved themselves. And then the money is spent on those children. So I just wanted you to know, be all upfront that they're aware of that and they're okay with that. Yes.
Okay, so the second component of the bill is to expand the focus of the program beyond one-to-one mentoring. So the way the statute's written, it's one-to-one mentoring is the only option. And given the fact that the legislature has never appropriated money for this program, but out of the goodness of the people who run this agency, out of the goodness of their hearts, they've found money to fund it. And number 2 ties in with number 4, which is, so we're expanding it beyond one-to-one mentoring to include group mentoring, peer mentoring, to try to achieve greater efficiency. We're not nixing one-to-one. We're just saying we're going to open it up and look at other forms. And then number 4 is tied into that. Currently, the statute says that you can't bill for more than $1,500 basically per child. And not only is this extremely strange that that's in statute, but we need to remove the cap if we're gonna expand the program to include other forms of mentoring where there could be more efficiency and the cost would hopefully be less. And I believe currently we're billed $1,500 per. So again, 2 and 4 go together. And then finally, we're just modifying the nonprofit applicant requirements. Again, the way the statute was written, it's very prescriptive of who qualifies to even apply to be this entity that would receive the funding. And so a couple of those we're modifying. One, currently the entity has to have a statewide presence. We're going to modify that to say or a regional presence in the state. And then the second issue is that this entity has to have served children of incarcerated parents for 5 years. We're going to lower that to 3 years in the hopes. I mean, we know there are other entities out there that may very well qualify. So we're just trying to loosen up the requirements without weakening them, but just make it more realistic. So.
Further discussion or modifications to the proposed?
Leave it to me to ask a question. The modification to subsection, I think that's 6, now F. It just says on or before November 1st of 2025, but this legislation would be passed after 2025, correct? So I just wanted to.
I think, are you talking about, yeah, that's just cleanup language. When we modified the statutes a couple of years ago to allow Office of Planning and Coordination to go on a 3-year basis, that just wasn't updated.
Okay.
So that's just cleanup language.
Gotcha.
And they may push back and say we need to make that 2026 because it should be after the fact, so.
Okay, all right, thank you.
Motion to approve.
Second.
Have a first and a second. You get a vote.
Commissioner Aaron,
Yes.
CEO Bullard,
Yes.
Director Cartmell,
Yes.
Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurt,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Middleton,
Yes.
Commissioner Reed,
Yes.
Motion passes. Okay, next we have some updates from our commissioners regarding the impacts of the federal shutdown. Director Cartmell, I'll let you go first.
Yeah, so I thought maybe helpful is to talk just a little bit about what we anticipated kind of mid-October for the impact to be, and then some of the decisions the agency made, and then also updates on as the government has reopened, what that means in terms of the decisions that we ultimately had to make at the end of October and the beginning of November. I do want to point out that this was an atypical government shutdown, which sounds a little weird to say that there are typical government shutdowns. But what was unusual about this one is that it began at the beginning of a federal fiscal year. Typically, when we see government shutdowns, they happen mid-year, which means that agencies like ours know what our federal awards are and have already received instruction from many, if not all, of our federal partners to continue to utilize those funds, and they will be reimbursed on the back end once the government reopens. This time, we didn't know what many of our awards would be, or if they would be there, and received essentially no communication and some public communication, although not direct, that states shouldn't rely on money being there when the government ultimately reopened. So from the beginning, it was a lot different than we as an agency had experienced in the past. The initial October impact was estimated at a reduction of approximately 8.9 million for our agency. This was after utilizing and exhausting federal carryover dollars that many of those grants still had within them. The November impact was estimated at a reduction of around 35 million. Again, most of those carryover dollars that we were utilizing in October would have no longer been there come November. If we got into December, that number would have increased slightly, but that's probably about where it would have ended up long-term per month. The direct impact was potentially on 26 programs across the agency and directly would have impacted 855 employees. Of the programs that could have been directly impacted had the agency not changed course and made some different decisions, would have been all of our SNAP programs. So not just benefits, but school nutrition programs, workforce training as well. That annual total is around $1.74 billion. CCDF discretionary funding, which annually is $160 million, give or take, that accounts for over half of the cost of the child care subsidy program. The Older Americans Act funding, which is just under 19 million annually, that funds in part our congregate care feeding or our congregate feeding sites and home delivered meals through our area agencies on aging. Additional lost funding or anticipated lost funding in October appeared to be our social services block grant, which is around $33 million annually. That is how we fund adult protective services and child protective services. And then the SNAP admin, which is 75 annually, funds approximately 15% of our overall agency payroll. And so looking at that prospect of what was to come, we had some very difficult decisions as an agency to make. There were essentially four really broad options before us. One is we could have done nothing and just simply hope things improved. We didn't think that that was a prudent path. We could have cut the programs and staff directly impacted by the federal shutdown. But as you can see, based on the list that I just read, cutting off adult protective services, child protective services, home delivered meals, half of childcare, those weren't real feasible options either. We discussed requesting early access to state appropriations. There is a mechanism that allows agencies in certain situations to request certain of their appropriations early. That we gave a lot of consideration to, but ultimately decided to not, really based on the fact that if we were to request June's 1/12 appropriations early, and that money wasn't reimbursed by the feds or the state, that would make our situation in June that much worse. Ultimately, the path that we chose to go down as an agency was to really use a scalpel and reduce spending and costs in a way that would have the least impact for our most vulnerable clients and the workforce that serves those most vulnerable clients. We took several administrative actions, including a part-time furlough of over 2,300 employees. Over half of our workforce was not impacted by the furlough, specifically our workforce that their income level was below 50,000. We temporarily halted hiring all non-frontline or health and safety critical positions. We significantly restricted travel. We suspended virtually all overtime utilization, and we pulled one-time funding that was available from some larger technology projects that we didn't yet have accounts payable or any monies due on to help fill some of those gaps. We also temporarily suspended over 350 contracts, right around 10% of the overall contracts for the agency. And then we also removed a COVID era $5 a day add-on for school-age children and froze applications for school-age children. The reason we chose that approach on the childcare spending is as we were looking at, again, the most vulnerable clients we have in all of these programs, we made a decision as an agency to prioritize our younger children, particularly when you considered that SNAP benefits at that time were not going to be paid. We really considered the fact that those school-age kids, if they're in school, would at least have access to breakfast and lunch and maybe a snack at school. And those younger children, if they're not in a child care facility, their parents aren't receiving their SNAP dollars, they may well not eat many days. And so we wanted to prioritize again our most vulnerable populations that we served. Obviously, the federal government has been reopened for, I think, a few weeks now. We are still not seeing all of the federal dollars start flowing. So there was this belief by some that as soon as the government reopened, the spigot would come back on and the agency would have access to all of the cash. That unfortunately is not the case. It's been a very slow process for us. We lifted all of the administrative actions effective November 16th. So the furlough as of this week is no longer in place. We're in process of unpausing impacted contracts. Many of you all may have contracts with our agency or we share common providers. Our team has prioritized with our program divisions the contracts to unpause first. And really the biggest delay that we're seeing is just getting clarity and certainty from the federal government of what those contract awards are and that the money will start flowing. But eventually those contracts that were paused will be turned back on. It's just really the delays being caused by the lack of federal funding that's still available as the government continues to reopen, which is an ongoing process. On childcare specifically, we're continuing to analyze the changes that we made to the program. We still don't yet know exactly what our CCDF discretionary amount will be for the year. In the CR itself, there was a $250 million decrease to that fund. We don't have an update, at least the last time I was updated, an update yet as to what our new allocation of CCDF will be. And so we're still waiting on some clarity from that and a couple other things from federal partners. But that was the impact that we anticipated, the decisions that we made, and then ultimately where things sit today. So I hope that was helpful.
Thank you. That was very helpful. Front.
Yes.
Go ahead.
So under our agency, we have disability determination services is one complete division that is totally funded by the Social Security Administration. And I'm got some numbers here, so I thought I'd kind of read it. So basically, Social Security pays benefits to people who can't work because they have a medical condition that's expected to last a year or result in death. This program in Oklahoma, we serve over 52,000 individuals. We have about 305 FTE, and we get a federal grant award of 49.6 million a year. So and this draws down monthly. And just as what Director Cartmell mentioned, this impacted this division significantly because when the federal government closes, we do not have the authority to continue to spend on medical, assessments, services that are needed to be able to determine whether the individual is disabled and should get on disability. So basically, when there's a federal disruption, it limits our existing cash. And so that was the most impacted division within our agency. We did not end up furloughing only because we actually, as much as what Director Cartmell mentioned that you can get on your appropriations, but we don't for this division. You can go to OMES and request money to loan from month to month to be able to make the payroll and continue the services. That is what we did, and they gave us 1 month. Beyond that, they weren't going to guarantee us kind of everything they said. The reason why they gave it to us, they undone the second month. And so as it turned out, we were able to capture some dollars and utilize them in the meantime from some other indirect cost areas. And so we never did a furlough. I was getting ready to send out a letter to be able to say we may have to furlough in December. But as it turned out, because the government came back into play, which I was very thankful for. And we didn't end up having to do that. Under our vocational rehabilitation basic support grant, basically, the way we draw that, it's 2-year money. We had carryover, and so we're really pretty good at all, fully flowing with our salaries and client services till March. And so, I figured if we got into March with the shutdown government, we weren't gonna be the only ones having a problem. So, and that program actually serves over 19,000 individuals. We have about 286 FTE, and our grant award yearly is around 52.8. Okay, so we have a $4 from the federal to $1 state match on that program. Our two schools, School for the Deaf and School for the Blind, are all state appropriations with the exception of a few federal dollars for under IDEA, that State Department of Ed, that we get from them, and some of the food and nutrition dollars for the cafeteria and feeding the students. So there was zero impact to them other than their families out under like DHS services. Obviously those are what we call auxiliary services for our families and our students. Let's see, there was something else. Oh, actually, Director Cartman, we actually were very fortunate. Within the second day of the government opening, we got 7 million back from the government for Social Security under disability determinations. So they caught up with the 2 months and that they had not funded us. So I was like, within 2 days, I too wondered how long it was going to take. And I was really impressed with how fast that came. And our vocational rehabilitation basic support program, we were able to start drawing down, from the new federal fiscal year and moving forward. So we've been very fortunate. One of the things that is looming over our head right now, in addition, is the Department of Education and the dismantling of it, because obviously IDEA for our students, the vocational rehabilitation program for services for the blind and visually impaired, and all other disabilities fall within that. So we don't quite know where it's all going to land. But right now, those programs come under the Office of Special Education and Rehabilitative Services under Department of Ed, and that OCCY is currently not moving yet anywhere. So it's just all kind of looming. We don't know where it's going to go. So is that helpful? Okay.
Commissioner Bullard, do you have an update for us today?
I don't have much of an update other than I am finally getting my sea legs. I understand a bit of where the people are housed inside of the building, what the responsibilities are, boards like this that I get to sit on and gain additional information on. But the agency's in a good spot. None of the SNAP or any of that stuff affected us in any way, shape, or form, thankfully. And then we're just planning for legislative session and things that are coming up, and other new commissioners and others and directors that are coming on board, and getting that figured out. And then our biggest focus really for this coming year is working with Commissioner Reed and health, just on rural health transformation, how that impacts, and really just being able to appropriate those dollars in a way that impacts Oklahoma short-term and long-term. And then how do those agencies all cross over to make sure that we're fit into the same process, to make sure they're sustainable, make sure those dollars are to the right people at the right time and be able to do it. So other than that, I'm sure I'll have better reports in the future as we get more projects, but we're doing all right so far. But thank you.
Yes, thank you for joining us today. Our other new commissioner that's here as well, we appreciate your attendance. Next, we have our director's report from Director Chakotay.
I just wanted to highlight a few things. I passed out the report this morning. I'm gonna jump to page 2. I just want you to check out the chart for CDRB. It's phenomenally different than it has been in the past. And if you notice it, we're gonna be we're really pretty close to closing out years 20 through 23, which will allow us to start doing trend analysis. And then we're already working on 24 and 25. So we're super happy about this direction. You're gonna see a more professionalized reports and information coming out of that department. And honestly, kudos to the CDRB team. They've really done phenomenal work. But I just have to say what a difference it is going from one person in a shop to having 5 paid people and 2 paid graduate students. And so for anyone who says money doesn't solve problems, I'm gonna say it sure helps. Because we have to have the capacity to do the work. And if there's not an example of that, it's this shop getting people to actually do the work. And I'm gonna say that for all the departments. When we ask for additional staff, it's not because it's some willy-nilly idea. We are just under-resourced. And when we have the right number of people with the right skill sets, the work can be done and it can be done in a meaningful way. And I just think they're setting an example. All of our departments are doing the best they have with the staff they have. And so I know several of you reach out to me from time to time and say, can we do X? Can we do Y? And I hesitate because we're barely doing what we're charged with in statute. And I would love to do extra projects as assigned, but I feel like we need to keep on keeping on with the required elements that we are charged to do with. So be patient with us. We are going to get to a point, I hope, where we can take on these extra duties or special interest kind of topics. But I'm so thrilled. I'm just so thrilled with where these folks are moving us towards. On page 3, you'll notice a new chart that you have not seen before. They also do near deaths. We are not as caught up in near deaths. And we will get there, but right now we've been focusing on the deaths. So we're going to start reporting this to you so you can see that start creeping up as well. Because as you've noticed today, one of the recommendations is about a near death topic. And for those of us who received those initial reports from child welfare, and we're so tired, and I'm sure Director Cartmell can attest to this, every week, and I doubt that there is a week that goes by that we do not see an initial report related to ingestion of THC in some form or fashion. And it is, if you're just thinking about the turmoil caused on the family and the child and all those involved, I want you to think about the costs. Because more times than not, Dr. Stockett says, because she sees a good majority of these, what happens is when the child presents to the trauma unit or to whatever ER is close by, they have no idea what's wrong with their child because they didn't see the child ingest anything. So this causes the ER to go into all kinds of hoops and jumps to figure out what's wrong because no one is saying, I think my kiddo ate blah, blah, blah. And you've got a kid who's not breathing, who's doing this and that, and we are spending an inordinate amount of money to figure out what is wrong with his child. They may or may not stay a night or 2 or more, but it costs us a lot to figure out this situation. So if nothing else, if you're looking at, tens of these going on across the state and we're life flighting them or doing this, that, and the other, it is a nice, huge expense for the state of Oklahoma to take care of that kiddo. And so I just want you to think about, if you don't even think about the emotional toil and all of that, the cost to this state to figure that out is, it's noticeable. It's noticeable. So I just want to point that out. So yay for that. Thank you for bringing that up. I also want to bring to your attention on page 4, the juvenile competency evaluations. We'll put in a table here so you can see the numbers that are occurring. For whatever reason, I don't know why, we have more evaluators than we ever have, but we're having fewer referrals from the courts. Don't know why. So as we have tried to improve our backlog, we're now getting less referrals. We're going to continue to bring this up in front of the Juvenile Justice Oversight Committee and talk to Judge Warren about this. Not quite sure why that's happened, but as we've improved our systems, they have backed off sending referrals. So that's kind of unfortunate, but it has allowed us to come into better or closer compliance with the 30-day complete the report. So we're now looking at an average day of 36. from the moment we learn about a referral to the evaluator having a report completed, which I think is fabulous. We need it to get to 30 or under. But again, I don't want these referrals to come in at a lesser rate unless that's just the way it needs to be. And that's actually what's going around the state. So we'll look into that. I just wanted to keep you posted about that. And then I think there's another issue I highlighted. Yes, I want you to turn to page 6. Director Cartmill asked me a while back, I think, about the School of Science and Math and have they had their annual inspection? Because if you were not here, if you notice on page 6 in state fiscal year 2022, where it says facility oversight visits, just I'm going to educate everyone and do a little reminder for some. There are 6 state-run facilities that we have to do an annual inspection of. School of the Deaf and the School of the Blind, COJAC, the Central Oklahoma Juvenile Center. I never can remember CRCS. I'm not even getting the acronym. Say it. CRC. Yes. Stands for.
Children Recovery Center.
Yes, we have to do that. I think that's that 4 or 5. It's 4. Somebody else, who's that other entity?
Was prepared to list them.
Somebody, and the School of Science and Math. So for years, we thought we were supposed to be doing 5. And it did not include School of Science and Math. And when I say for years, it's since I was here. So when I showed up in 17 or 18, we had not been doing the School of Science and Math, and I didn't even have it on my radar. And we got a request from a reporter, Jennifer Palmer, if I believe, who said, I need to see your latest report on the School of Science and Math. And I was like, what? And that put on my radar, we should be out there. And we had a discussion at this meeting about should we not be out there? Because there had been a decision at some point prior to me being here not to go out there and conduct those oversights. So we very clearly came to a decision that fit the criteria that we should be out there, and we went back to doing those. So you should see in that column, ever since that year of 2023, the number of 6 being done by the end of the year. As you note, we haven't done any this fiscal year, but that doesn't mean we're not going to. It just means we've been really busy with other things that are not oversight visits. We're doing more complaints. Some of them have been pretty involved, so we have not done those. Or the report's just not finished and it's in the editing process. So always look to see at the end of a fiscal year if that number is 6. And if it's not, you need to ask me why. But Director Cartmill, thank you for asking. I also want you to know that we've been talking to Mr. Mowdy here about what kinds of information we can share with you as commissioners about either complaint reports or oversight reports. It's a little tricky. It's a lot tricky. So while part of me wants to share a lot with you, there are good reasons for us not to share some information or all information depending on what the actual situation is. So we're working with, first and foremost, trying to figure out the legality of doing some of that. And then we have talked to commissioners, some present today and some previously, about creating a work group. But first I want to understand what we can release legally. And as Mr. Mowdy can attest, it's more complicated than we'd like. We've also talked to our previous Assistant Attorney General who, under his watch years and years ago, they did release some information, but it's even his opinion now that, maybe not such a good idea. It's very complicated because you guys have conflicts with information. Some of you will, because it'll be about your entities. So all that to say is we are working on it. I don't want you to think we have forgot about that. I do think it would be good. I can imagine if I were in your seat, I would want to know, like, well, what did that look like? Were there any violations? I mean, I get that. And I think in some ways the public should know, right? But I also know that there are lots of sensitive information in these reports with names and all kinds of things. And by the time we redact it, or maybe we just pull out some of the essence of it for you, it may not be as meaningful anymore. So we're trying to figure that out. And we will work with you if you're over that. Yes.
JD McCarty Senior.
Thank you, JD McCarty. Thank you. Yes, I knew there was another group. So yes. And with that, I'm happy to answer any questions. The rest of it, I think, is pretty self-explanatory, but I wanted to bring those items to your attention.
I don't have a question. I have a comment, and I
Yes.
think it's just reiterating was the incredible importance of this agency to provide oversight, planning, coordination of children's services. And I think we're in an era where there's a lot of distrust of government agencies, especially self-serving interest. And so to have an agency like this that sits outside of those agencies but provides information for them, I think is a priority. And I also believe we're in an information renaissance, with AI and the recent executive order of the president to modernize child welfare data infrastructure and collecting. And I think that as the directors of our state agencies sit around this table, and we have to be able to rely on the data that OCCY is providing. And the only way we can rely on that data is if we fund OCCY appropriately to get that data and present it in a way. And I don't expect a report back on any oversight or investigation, but I do think it's crucial that we get data, aggregated data, trend analysis data, so that we can see as a commission if we're doing what we're supposed to be doing, or if we need to raise a flag.
That. Yeah, I just want to say thank you. And as a reminder and update for those of you who are new, our budget request in particular asks for additional staff for the Office of Juvenile System Oversight. And one of the reasons is we can't keep our head above water. We can't finish the report before another sometimes big issue pops up. And that distracts us from, because you can't do an investigation 6-7 months too late, right? It's too cold by then. So you kind of have to jump from one issue to another before you've even finished this over here. And it's not good. And in addition, we're so busy with those kinds of one-on-one kind of incidents, we don't get to look at the big picture. And that's what you guys need to be seeing. And we clearly recognize the miss in that, right? And years ago, I think this agency, when they had a little money, would kind of mediate the lack of staff or maybe even the skill set for doing that by hiring or working with universities to look at a subject matter, dig deep, and then come out with a report. And we could have done some of that when we had money, but we certainly don't have money now to do extras. And that's what I wish we had. But even just having additional staff would allow us to get reports back to agencies in a timely fashion, so it was more meaningful to them. And they could use it as perhaps validation to what they have found or already done, or perhaps they go, oh, didn't even notice that. Think of that. We're going to pivot and do something extra. But if we get your report too late and you've already made all your plans, then it's just not as meaningful. And we recognize that. We just don't have the capacity to run that shop the way we want. So they're doing their best. They're doing their darndest, I promise. It's just we need more of them. So asking for 4 staff, if I remember correctly, to help with that.
Thank you, Annette.
That's it.
Thank you for your leadership and your team's work. We appreciate all that you do. I don't have any further remarks. Are there any announcements from the commissioners? No, we are adjourned.
Thank you so much.